What are normal AFP levels for liver cancer by population? Imagine trying to catch a signal from the body that might hint at liver trouble. That signal is often alpha-fetoprotein, or AFP, a protein produced during fetal development. In healthy adults, AFP levels are usually very low or indetectable. Typically, if you get a blood test, normal AFP levels are considered to be under 20 nanograms per milliliter. Some labs might set the upper limit slightly higher, up to 40 nanograms per milliliter, depending on their standards and the population they serve. But generally, if your AFP is below 20, it's seen as normal for someone without liver disease. Now, when it comes to liver cancer, especially hepatocellular carcinoma, AFP levels tend to rise. About 60 to 70% of people with this type of liver cancer show elevated AFP levels. Doctors often look at AFP levels above 400 nanograms per milliliter as a strong indicator of liver cancer in someone with a liver mass seen on imaging scans. Some guidelines suggest a lower cutoff of 200 nanograms per milliliter for diagnosis, but levels between 20 and 400 can be tricky. Mild to moderate increases can happen in chronic liver conditions like cirrhosis or hepatitis, or even in other types of cancers. Interestingly, around 30 to 40% of liver cancer patients may have AFP levels below 20 nanograms per milliliter, meaning their AFP tests are normal even with cancer present. That's why AFP alone isn't enough to diagnose liver cancer. It's just one piece of the puzzle. Population differences can influence AFP levels. For example, in regions where hepatitis B or C infections are common, baseline AFP levels might be slightly higher due to liver inflammation or damage, but the diagnostic thresholds for liver cancer stay consistent worldwide. Pregnant women naturally have higher AFP levels because of fetal production, which is unrelated to liver health. So, when doctors interpret AFP results, they consider these factors. They usually combine AFP testing with imaging studies like ultrasounds or MRIs, along with other clinical assessments, to get a clearer picture. In practice, AFP testing is especially useful for people at high risk, such as those with cirrhosis or chronic hepatitis. These individuals often have ultrasounds every 3 to 6 months to monitor for early signs of liver cancer. If AFP levels rise, it prompts further imaging and evaluation. For patients already diagnosed with liver cancer, AFP levels help doctors track how well treatment is working and predict outcomes. Higher AFP levels often correlate with a worse prognosis, but again, it's not the only factor. To sum up, in adults, AFP levels below 20 nanograms per milliliter are generally considered normal. Levels above 200 or 400 nanograms per milliliter are strongly suggestive of liver cancer, especially when combined with imaging findings. But because many liver cancer cases can have normal AFP levels, this marker is used alongside other diagnostic tools. Population differences mainly affect baseline AFP levels due to the prevalence of liver diseases, not the core thresholds used for diagnosis. Always remember, if you have concerns about liver health or AFP levels, it's best to consult a healthcare professional who can interpret your results in the context of your overall health and medical history.